The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Hi, good evening viewers. Welcome to today's episode of KIMSHEALTH Doctor Live. Myself, Kripa Rajiv. Health is wealth. We are taking tiny steps to build a better health. In this episode, we have taken the topic common orthopedic issue. To talk more about this topic, we are having an efficient doctor with us. He is working in KIMSHEALTH Hospital, Lazim. He is having 10 years of experience in Orthopaedic Specialist. It's my pleasure and privilege to welcome Dr. Kiran to the show.
Okay.
Hi Doctor, welcome to the show. How are you, Doctor?
I'm okay. Thanks.
Can we move ahead with the topic?
Yes.
Recent days we are seeing that many people's having neck pain. Can you please explain what is the probable cause for that one?
Yes, that's a very good question and it's a very practical question. I see a lot of patients now from all the age groups having neck pain and upper back pain. And recently there is increase of people having neck pain is because mainly because of this COVID pandemic, many people have started working from home and that's where the work desk is not proper, and that is when they sit on the sofa working on the laptop, always bending the neck and straining the neck. This is one part of the thing. The second thing same applies to the children. Even the kids are schooling from home, the online schools, they have been exposed to a lot of screen time, they have to use the laptop, they have to use the phones. And this has been happening since last 2 years on an everyday basis. So that's when these issues of neck pain, where the neck muscles under a lot of stress. So there is sudden surge of people having neck pain, and these are the most common reasons. The other reasons may be the the wrong position of the neck while sleeping, not using the pillow, or lifting heavy weights without any proper support. So these are the things which causes the neck pain, which we see recently with the common practice.
So doctor, what can be done to reduce this frequent episode of neck pain as well as low back ache?
Yes, neck pain can be, the episodes can be reduced by keeping the neck straight as much as possible, like as if, you know, when we are looking into the phone, instead of always looking down like this, you can always, you know, keep it straight. I know it's not very practical, but try as much as possible to keep your neck straight, and use a proper pillow when you go to sleep, and regular exercises will help, like swimming and all will help keeping the neck muscles in tone, and that's how the neck pain can be avoided. It's mainly the position, lifestyle related. The screen or the laptop should be straight. It's not too high or not too low also. It should be at the level of the neck, so that reduces the pain itself. That is how the treatment for the neck pain starts. Later comes the medications. Yes.
If a person is having injuries like a twisting of leg or a fall, what can be done immediately at that spot?
Yes, no, this is the other set of the issue where people are just walking, unexpectedly they have the step over there, they twist their ankles, or the knee gets twisted and they have a fall. Sometimes they prevent the fall. Immediately there is a swelling and the pain. So what should be done at that moment is not try to give weight on that leg and walk. People think there is nothing wrong and they try to walk on that painful leg, which increases the pain, which increases the swelling. So avoid giving weight for that moment, and then ice, if you can get ice over there, put some ice over there and keep it elevated. That reduces the swelling, and immediately attend to visit the hospital nearby. So on the spot things have to be done is the avoid giving weight on that part of the leg, avoid they put some ice and then keep it elevated. Yeah.
Coming to the fractures, what fractures need a plaster and which all need an operation?
Yes, so it's a very practical question. Many patients ask which any fracture is there, which can be applied a plaster, which have to be operated. There are a wide range of options we look into which have to be put under plaster. Not every fracture needs a surgery. Some can be treated with the plaster, but there are something called stable and unstable fractures. The fractures which are stable in the plaster can be used, but which are very unstable, they keep they don't maintain the position even in the plaster, have to be operated. But that's again for the hands we look into some other stuff, for the legs we look into the other options. But yes, looking at the X-ray, and different fractures need different treatment. Some need plaster, some have to be operated. We cannot generalize all all can be treated by plasters.
Okay. Can you please explain us the role of physiotherapy in orthopedic?
Yes, so physiotherapy is an allied branch of orthopedics, like the patients who have neck pain, low back pain, or any joint pain like shoulder issues, the physiotherapists give them the muscle toning exercises which help in reducing the pain, and also which increase the mobility of the joint, which will help us to give less painkiller medicines. This helps us in prescribing less medications, and patients are recovering with the mode of just exercises and natural way of body healing. So that is one kind of it. And physiotherapy also comes in role in the patients who have fractures. The long time they are in the plaster, once we remove the plaster, the joint goes in for stiffness. The muscles are weak that time, so the physiotherapists have to train the muscles to get back the strength, and the mobility of the joint has to be brought back to how it was before the injury. So this is where the physiotherapists play a very big role, and soon after, the recovery part is all left with the physiotherapist. And and neck and low back pain also, many patients are getting a good relief with the physiotherapy. Yes.
Can you please explain what is arthritis of joints?
Arthritis of the joints, as in there are two types of, basically two types. To explain in a common words, one arthritis which comes in the younger age group, and one which comes because of the aging in the older age group. So a few kind of arthritis to name in the younger age group is psoriatic arthritis or rheumatoid arthritis, and which can include any kind of age in the people. But the osteoarthritis, which comes mainly because of degenerative changes or aging, that comes in the older age group mostly, and that is the osteoarthritis. Usually to say in a simple words, the lubrication inside the joint is reduced, so the mobility becomes more painful. So our aim should be not to get it more worse and improve the mobility with improving the lifestyle. So arthritis is, the understanding of the arthritis is a major role for us as doctors, treating doctors, and to the patients who get treated. They also should now have a overview of arthritis. They should not be just concentrated upon just pain relieving management. They should be knowing about the concept of arthritis, what we are doing and what they are getting from us. So that goes in a lot of understanding of the whole arthritis itself. So the treatment part is just not medications. It's about the understanding of the pain, why it is coming, and what next. So arthritis is any pain in the joint which reduces the mobility, and it can be of any reason.
Doctor, coming to that point, I have a doubt, doctor. Many of the person who's doing some extracurricular activity like a dance or a sportsman, they are having a knee pain. Sometimes if they are sitting in a place, they cannot move. Is it the symptom of arthritis?
Yes, many people have the knee pain which doesn't include any injury, but they are doing just some physical activity. They are sitting in one place for a long time and they just try to get up, they get a knee pain. That always is not arthritis. Again, we have to categorize according to the age, what age the person is getting treated for the knee pain. There is some kind of strain which is coming onto the knee, like too much of physical activity can strain the knee. Giving some rest will reduce the pain. That is one thing. Then the pain increases while doing the activity. We have to check a couple of things like uric acid and other stuff to see what exactly is the cause of the pain. We will be coming into it later anyways. But not all knee pain is the beginning of arthritis. We should categorize the patients based on the age group, what exactly happened before the knee pain started, and what the clinical examination tells us. Then we can say whether it is, yes, it is arthritis, or it is not a part of the arthritis, it is something totally different. Maybe some synovitis, some strain in the knee, some ligament injury. Those don't come into the part of arthritis.
Okay.
Yes.
Just now you told about uric acid.
Yes.
Even I heard that whenever there is a leg pain, everyone commonly just check your uric acid.
Yes.
Can you please explain our viewers what is the role of uric acid?
Yes, uric acid is actually it's a serum uric acid. We have to do the blood test. What the main important, the patients come with the sudden onset of any joint pain. Mainly it can be any foot, great toe pain, ankle pain, knee pain, or a shoulder pain. It can be any joint pain, or without any injury. Patient was not doing anything, he didn't have any injury, but suddenly the pain started all of a sudden. Maybe he woke up with the pain, and then when there is no history of any injury, we have to examine the joint, what exactly, if it is swollen or if it is very painful on touching, movements are restricted. Then we have to ask the patient whether any previous history of high uric acid is there. Uric acid is basically in our food, the high protein or high purine diet what we take. What I tell my patients is treating the uric acid is just not medicines. Medicines come at the last. The first thing is adequate water intake. We forget in our busy life and sitting in the AC to have adequate amount of water. The body gets dehydrated and then the uric acid level shoots up. So the first line of treatment for the uric acid is have adequate amount of water. Second thing is, once the pain is reduced, have some physical activity every day, at least basic things like some duration of walking or cycling or swimming, which will help metabolizing the things so that the uric acid doesn't shoot in the body. Third one is the heavy the red meat, what we call the red meat, the food items which include a lot of purines, and those kind of food stuff have to be avoided. Last comes is the medicine. So the treatment of the uric acid, hyperuricemia, when the uric acid is level, it is hyperuricemia. It can lead to sometimes gout attack. When the patient will not be able to walk at all, they come in the wheelchair saying severe pain, swelling in the joint, that's a gout attack. So the proper diet control, counseling has to be given. Medicines for the pain has to be done, and they usually recover. But it's a long, it's a continuous process. Whenever you lose on any of this diet, it can shoot up again, and when you keep your diet control, it reduces, and the medications do help in that. So the uric acid is mainly a lifestyle based and food habits based related, but one has to be very careful about it. Has to be screened every 6 months to 1 year.
Doctor, like uric acid, another common problem is vitamin D.
Yes.
Can you please explain about vitamin D also?
Yes, vitamin D is the main source. It's actually, we talk about vitamin D so much recently that the main source of vitamin D, as we know, is the sunlight. The sunlight has to, sunlight doesn't have a vitamin D, but sunlight rays fall on the skin, and the skin creates vitamin D in us. But because of our indoor lifestyle and not exposed to much of outdoor and proper adequate sunlight, there is much of a vitamin D deficiency in the the common population all over the world. It doesn't mean that we have to stand in the sunlight for hours and get some sunlight and vitamin D. No, usually vitamin D deficiency can cause, commonly, is the body pains and patients feeling tired, joint pains, and apart from orthopedics, the other symptoms may be hair fall or something the patients do complain. It's better to check vitamin D for any patients with any joint pain or muscle pain, just to make sure that we are not missing on the vitamin D deficiency. And supplements have to be taken for vitamin D. There is vitamin D option in the food also, but the amount of food contribution to the vitamin D in our body is very less, so I don't ask my patients to have this proper diet for vitamin D. Supplements are necessary. If there is a deficiency, there is a course we have to give for 2 months once it comes to the proper level, and then we have to give the maintenance dose. So the loading dose and the maintenance dose. But yes, it comes to depending on how the previous report was, every year once at least the vitamin D has to be checked. Whether you have symptoms or no symptoms, it has to be checked.
Okay.
Yes.
Doctor, can you please explain us the home remedies for neck pain as well as low backache?
Coming to the neck pain, the home remedies, as I mentioned earlier, as much as possible, keep the neck straight, sit with a straight back, stooping like this with the back will again get all the muscles cramped up. So sit, with the proper back rest, and the neck should be straight. And whenever there is the attack of pain, where the severe pain is there, first thing what we can do is warm water, the hot water, the bag what we have. You can do some hot water application here in the upper back or in the lower back for 10-15 minutes. That helps a lot. And have lots of water, because dehydration, again, as I said before, leads to a lot of muscle pain and muscle cramps and everything. So adequate water intake, regular exercises, stretching exercises help. One thing which should be avoided is in our daily lifestyle is suddenly bending forward to reach anything on the floor. If, for example, if anything falls down on the floor, we suddenly tend to bend and lift it. That sudden movement can give a shock to the lower back muscles, and suddenly you can get a catch. And that should be avoided. It should be done with the careful. When you are bending forward, I don't say don't never bend forward, but it should be done with much care. Slowly bend your knees, and there is a way you reach to the the thing and you lift it. So that is one thing. Suddenly bending forward and lifting the thing. And the other one is avoid lifting heavy weights. Like the most common thing what we see in our households is the water can. The 20-gallon water can, we have to lift it from the floor and put it on the dispenser. So that itself takes a lot of stress on the back and as well as on the neck. So that has to be done. There is no option. We have to, somebody in the house has to do it. So do it in a proper way. Don't keep your phone in the between and then try to put that water and all that. When you're doing something, focus on that. Do it slowly, in a proper way. No jerky movement. So it should help. Regular exercises also will help. So these are the home remedies which I tell all my patients. Keep the screen straight. Don't bend forward. Avoid lifting weights, and have adequate amount of water. Yes.
Can you please explain us which are the most commonly used radiology tests and how important they are?
Yes. To come to a diagnosis, sometimes many times in the orthopedic practice we have to depend upon the radiological test. Like the basic one is X-ray. So X-ray is the one which tells us what is exactly happening with the bones inside, which we cannot see from out. But if the patient has a neck pain, whether it is any arthritis in the neck or in the lower back, can be told only, can be seen only on the X-rays. And any for the people having any twisting injuries, any fall or any trauma, to see if there is any fracture or if there is no fracture, we have to do the X-rays. So X-rays are the extensively used in orthopedic practice. And the next comes is the CT scan. The CT scans are to see if there is any complication in the fracture. For further diagnosis, we use CT scan as well as MRI. MRI is the magnetic resonance imaging, which we usually use for the patients with the back pain or the neck pain, to see if there is any disc problem. Everybody knows about this disc. There is a disc is actually it's like a soft jelly thing which is in the spine. So when that is under stress, it starts putting pressure on the nerves. So what exactly is happening? So we get the exact picture of that in the MRI. Though we don't get that in X-ray, we get those exact picture of on the MRI, and then we can decide whether the patient has to be given physiotherapy, or the patient has to be advised for surgery, or patient can just take medicines, use the collar for some time. So these things help us a lot in diagnosing and further treatment of the patient.
Can you please tell us about ligament injury and the role of arthroscopy?
Yes, ligament injuries, as we discussed about any sports injuries, if there is any kind of sports injuries, like while playing football there is a twisting injury or somebody hit the knee, not every time the bones are broken. There are something called ligaments which are in the joints, like as in there are multiple ligaments around the knee, there are multiple ligaments around the ankle. They play a very major role in balancing the knee stability and everything. So patients think if there is no fracture in the X-ray, so the treatment is over. But for us, it makes sure that we have to see there is no ligament injury also. Clinically, we have some tests we can do to see whether there is a ligament injury. But again, MRI gives us a proper image of what exactly has happened with the ligaments. Yes, if the ligament is injured, then we might have to do some physiotherapy if it's a mild injury. If it's a severe injury, sometimes we have to end up with the surgery. So when we are doing the surgery for the ligaments, mostly 90% of the times we use something called arthroscopy. Arthroscopy is like a keyhole surgery, like a laparoscopy for the general surgeons. We have arthroscopy. So there are only two small keyholes made. We don't cut open the whole thing. So the camera is put inside and see, and the ligament repair is been done. So arthroscopy can be done for the knee, for the shoulder, for the ankle, for any of these major joints without opening the joint. We don't, there will be only hardly 2 stitches, just for the one for the camera and one for the probe to go inside, so to set right the ligaments. Arthroscopy is for the ligaments we use in the joints actually, for sports injuries.
Doctor, can you please explain the recovery time of keyhole surgery when comparing to other surgery?
Yes, the most advantages of that arthroscopy or the keyhole surgery is the recovery time is very less. Maybe you can say it's no actually, because immediately once the surgery is over, the next day itself we start doing the physiotherapy for the patients. And for some minor ligament injuries, the patients can start walking, especially for the knee. And for the shoulder, if we are doing any ligament injuries, the rehabilitation or what we call the physiotherapy or the recovery time starts the next day or the same day itself. Based on the pain factor of the patient, usually the pain will be very less, and there will be no, most of the times if there is no complication, the plasters are not there, are no braces, there are no supports, just the small dressing will be there, and patients have to start mobilizing the joints immediately. So the recovery time is very minimal when we do an arthroscopic surgery, especially for the ligaments. So the patients can get back to their normal lifestyle very soon.
Everyone is very curious about joint replacement. Can you please explain us the outcomes of joint replacement?
Yes, so we discussed about the arthritis in a little while ago. So arthritis in the elderly age group usually leads to the lot of degenerative changes in the joints. The knee loses its normal shape. There is something called the synovial fluid, which is actually like the common man, so it's an oil which is there inside the joint, which gives the mobility for the joint. That starts reducing in the arthritis, and there's something called cartilage, which is very important in maintaining the joint congruity. So arthritis is basically the cartilage is getting worn out, and the oil is getting less. So what we do is we have to replace these two parts with the metallic parts. We use this joint replacement. There is something called half joint replacement, and there is full for the knee. Half means only which part is affected, we can replace only that, not the whole knee. So the recovery is very fast. And if the degenerative is totally in the whole knee and it's very much bad, the patient is having continuous pain, the medications are not helping, physiotherapy is not helping, basic life routine like walking and sitting and standing is becoming difficult, then we plan for joint replacement surgeries. Joint replacement surgeries are, people ask, joint replacement surgery is a major surgery, is it okay for older age group like 60 years plus? Then I have to say the arthritis, the osteoarthritis comes in the older age group, it doesn't come in the younger age. So these surgeries are designed for the older people and to accept the bone quality of the older people. So these implants are very high and high quality implants, and the whole design of that surgery itself will help in reducing the pain. Imagine the patient after the the joint replacement, the pain will be less, the movement will be very good, and the basic lifestyle activities, the activities of daily living, what we call the ADL, will be very good in the patients who have undergone surgery. Depends, some people take only one knee, or if both knees are affected, we have to decide according to the patient. The outcomes are very good, and if the patient is having a lot of pain and in proper indicated patients, it give good results also. Yes.
So doctor, I guess we have covered almost all the queries related to our topic. Can you please give a takeaway message to our viewers?
So the takeaway message is, as I mentioned, I just brief about all the things. So the takeaway message is, as much as possible, don't bend your neck while looking into your phone or your laptop or anything, and don't lift too much of weights without supervision. Be careful while bending forward and taking into any heavy objects, and whenever there is don't home remedies, as I mentioned, any warm water usually helps, and when the pain is very severe, don't hesitate to visit the hospital.
Thank you, doctor. Thank you for joining with us and answering all our queries. Next week, same day, same time, I'll be back again with yet another doctor. Until it's Kripa Rajiv signing off from KIMS Health Doctor Live. Take care and bye-bye.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Revit. Send money online to India. Credit in seconds with great rates. Download NEC Revit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.